Oh, we're going live now. We're live now, I think. Yeah.
And we're live.
Yeah. Oh, well, let's give some people time to get in here. Woo. Y'all nervous?
I am.
A little bit. A little bit.
You shouldn't be. Let's give some people time to get in here. Okay. So we are live now.
You might want to turn that off. Two people.
Okay. Hello, everyone. Okay, we can get started.
You want to give them like?
Okay, well, Brenda says let's.
How about 2 minutes? We'll give them
2 minutes.
They might have thought we weren't on since we didn't get on time. Like somebody was. You know what they both.
I'm trying to get to know my panel.
Morning, Lori. Hey, Ma.
Good morning, Lori. Shameika, where are Princess? Oh, maybe I shouldn't.
Where's Princess?
Oh, I'm at Sherelle's house, so she's at my grandmother's house.
Oh, I thought Sherelle was your grandmother. I love Sherelle, by the way.
We got to get to know each other a little bit better, Mika.
Who, you and Sherelle?
No, me and you said we'll notice things about each other.
Oh, you don't? Where's my mother?
So if you're on and you're just looking at our beautiful faces, we're waiting for a couple more people to get on, or 11:05, whichever one comes first, and then we'll.
Well, it's 11:05. So.
Well, it's 11:05, so I guess we're not gonna wait anymore. Are you ready?
I am.
Are you sure?
I am.
All right. So my name is Brandon Isaac, and this is my wife, Tamika Isaac. We are the founders of Jace's Journey. And today we will be interviewing Dr. Shameika Stokes, nurse practitioner Natasha Kenan, and Dr. Ana Alvarez. I don't have what's the word I'm looking for? I don't have the vocabulary deep enough to explain all of their goings on. So
they have the whole alphabet after their name.
Yep. So we will let
nurse practitioner Natasha Kenan is also joining us today.
Yeah. So we have some very smart people in the room. For informational purposes, I have a master's degree in strategy planning from a certain university, and Tamika has a master's degree in HR and an MBA. So a lot of smart people here. So we don't profess to be as smart as they are, but we can hold a decent conversation with them. How's that? Yeah. So we will start with Shameika, then we will go to Ana, and then we will round off the introductions with Natasha Kenan. So Shameika, please tell us a little bit about yourself and your background and what you study at in your doctoral studies.
Okay. So hi everybody. So I'm Shameika Stokes. I have a doctorate in social work. I also have a master's in social work. I'm a licensed clinical social worker. So I am a professor of social work, and I'm also a licensed clinical social worker. So I'm a practicing therapist here in the state of North Carolina. So I title myself a lot of times as an educator and advocate and a mental health clinician.
Okay. And what was your dissertation on when you were going for your doctorate degree?
Okay, so my research was in exploring and examining mass incarceration. I'm very, very passionate about mass incarceration specifically and how it affects African American men, or rather Black men. And so for my research, I focused on addressing drug selling recidivism in rural communities with Black men. So really looking at Black men in small communities and drug selling as a problem. Because one of the things that I ended up finding out in my research is that, of course, we know that prison is a revolving door. It tends to look like a revolving door. So my focus was sort of, who are these people that's going to prison? Why are they going to prison? And ultimately, what can we do to change those outcomes?
Good. Thank you.
Yeah.
And as we get their backgrounds and what they studied, we'll tie it all into how it all relates to Jace's journey, our mission, and our objective, and what we hope to accomplish in the very near and distant future. So now we have Dr. Ana Alvarez. Could you please give us a little bit about yourself?
Yes, of course. Good morning, everyone. My name is Ana Alvarez, and I am in Los Angeles, California. I have a Doctor of Social Work and also a Master's of Social Work. Currently, I am a Community Relations Manager for a healthcare company, and I'm very passionate about not only the micro part of social work, but also the macro side of social work, where it really looks into policies, creating programs, and really being able to implement innovative programs in society that can really impact change. And that is one of the roles that I currently hold and with my current employer. As part of my dissertation, I focus on the grand challenge of promoting smart decarceration that really looks into really studying the history of how mass incarceration really started in the United States and how it led to the mass incarceration of African American Black males in society. And my primary focus in this study was really to address the low employment outcomes for African American Black males in society due to their criminal background, but also to the stigma, stereotypes that society has about Black African American males. And I really wanted to focus on that specific area of employment because I'm program coordinator for a reentry program here in LA. And it was such a challenge to get participants of the training programs into employment after they had completed training courses, certificates. Employers did not trust them. Employers were very reluctant to hire. So that's where the passion came about for my dissertation, and really understanding what can we do as a society to implement change and to give African American Black males an opportunity to really excel in society.
Wow. Yeah.
I'm impressed.
Me too. And the fact that you work for a healthcare system actually really ties a lot into, our mission. So yes, welcome. Thank you for sharing that. Wow. And last but not least, the beautiful Natasha.
Oh my goodness.
Kenan.
Hello, everyone. So yes, I am a recent graduate of a nurse practitioner program, and I am in transition. So I am currently studying for my boards for my certification. So I work currently at a local hospital in Durham as an administrator, and I will be transitioning into a full-time nurse practitioner role very shortly. So I do have a master's in nursing. I also hold a master's in public administration. And so I didn't do a thesis or a dissertation, but my master's project was on how to educate healthcare providers on the maternity, African-American maternal disparities. And so that was my project. And Tamika and Brandon so graciously shared their story, and so that we can educate future healthcare providers so that we can lessen the healthcare disparity gap amongst African-American women and families.
Awesome.
And so, that is, as I went through my program, and as we all see, African Americans, people of color, are disproportionately affected by chronic health diseases and lack of cultural sensitivity, and providers not being culturally aware, and so they have higher or worsened health outcomes.
Awesome. Oh, thanks.
Wow.
So that's I'm pretty impressed by all of you. I don't
Show's
know.
over. Thanks, guys.
I'm gonna follow that. But so the mission and purpose of Jace's journey is to essentially change the narrative of or change the narrative or help kind of shed light on maternal fetal medicine and the disparities therein as it relates to the African American community. So Tasha is kind of on the front line of that. And also how Dr. Shameika and Dr. Anna's passion correlates that is with them kind of focusing on the recidivism or the mass incarceration. And that aspect is taking the Black father out of the household. So it's basically leaving a lot of contributing to a lot of single mothers, and those single mothers having to essentially fend for themselves and kind of fight the medical system that is already stacked against them. So they essentially are trying to advocate for themselves and don't have a strong male figure to help advocate for them. So that directly ties into kind of how they could be possibly bullied while they're going into a doctor's office. Nobody to kind of help bounce ideas off or give them questions when they need to ask doctors or when they need to stand up for themselves. So their perspective will kind of help shed some light on our perspective. And Tasha being in the healthcare industry or field, and as well. So with them being in that field as well, that will kind of help shed some light on that side of it from a practitioner aspect. So so I know one of the questions we had, and like, how do you feel being from Honduras? Maybe I don't know if you like what age you came over, or like how do you feel about what's going on right now?
I think that's a really good question. I have to start off by stating that I really had to educate myself about my Blackness, what it means to be Black. Coming from Honduras, we don't have all the diversity we have here in the United States, right? So it was definitely a culture shock for me to really understand the different backgrounds, but really to understand myself and understand that I am a Black Latina. Now the term is Afro Latina. I am Afro Latina. I am from African heritage. I'm very proud, but I also have that Latin background as well. And I'm going to be very transparent. Coming into the United States, initially in my younger years, I identified myself as a Honduran, I identified myself as a Latina, but I did not identify myself as a Black woman, Afro Latina. But that has to do from, where I come from and how that culture in Honduras is. But as I grew up and as I educated myself, I learned about my history. I learned about what it means to be Black in America, honestly. And one of the first experiences was in undergrad and being told, "Oh, you're in college. How did you get here?" and I was very shocked by that. That statement, and really that motivated me even more to raise awareness, to really speak up for not only myself but for others, so that people understood that the stigma, the stereotypes they see on TV is not really real. And I'm very proud of my Afro-Latina background. I'm very proud to be Black. I'm very proud to fight for social justice. I'm very proud to speak up for the racial disparities, for the social injustices. I feel more confident to educate my family, my friends, and employers, colleagues about the misconceptions that a lot of individuals have about Blacks in America, because I think that what is happening now is really an opportunity for us to continue conversations about what it means to be Black, and also for me personally, what it means to be an Afro-Latina in America, having to battle being accepted not only in the Latino community, but also in the Black community, and what that means. So hopefully I answer your question.
I think so.
Yeah. So basically, your viewpoint is so what's going on is allowing the conversations to be had. So the conversations that needed to be happening for so long, as unfortunate as it is, George Floyd lost his life, Breonna Taylor lost her life, and so many others have lost their lives. It was essentially, this is the straw that broke the camel's back, or the wind that brought the house down. And it's like, okay, the house is starting to fall down, and we need to address some foundational issues in America and in our community. So that's essentially what.
Yeah, and one of the reasons why I wanted to have this conversation is because a lot of people are really focused on the George Floyd thing, and we know that, like he said, that's the straw that broke the camel's back. But I want people to realize that this is not just about George Floyd and police brutality, right? Like, we're not just fighting this one battle. This is a battle that we've been fighting for years. And I think just watching that video and then people actually seeing how he was unarmed, he was in cuffs, and so he wasn't a threat. But I think people actually seeing that happen real time kind of just made everything come to light. Like, there's no excuse that you can give right now for why this man died. And, people have tried, like, oh, he was a criminal and all this other stuff. But you can't tell me in any form or fashion that this man should have died that day under the knee of a cop. So what was important to me was for people to realize that this is not just about George Floyd. This is about everything.
Right. And I think another thing we're pointing out is that the same thing that the thing that's happening the most to African American males, specifically in this country, in terms of mass incarceration and being unfairly stopped or unfairly policed or whatever's going on. On the flip side, the same thing with the same amount of intensity, the same amount of focus is happening to the African American woman as well. So they're getting the same neglect or the same unfair treatment, or as in your case, Dr. Ana, facing some forms of microaggressions that if you're not smart enough to pick up on, then you kind of don't notice it. But they're, because Tamika had that same type of microaggression towards her when she was in a doctor's office. So, but she was smart enough to pick up on it and kind of call them out. But how many other people might not notice it or just passively let it slide. But the goal of this journey is to kind of bring some of that stuff to light and kind of educate people and help people, help women in particular know what they're looking for when they go to these appointments and checkups and so forth.
And have these conversations.
Right.
So to sum that up, Brandon, what police officers are doing to Black men, doctors are doing to Black women. I think I shared that on Facebook the other day, but just to give like a perspective. So did you?
I was going to ask Shameika what you thought about what was going on. So, Dr. Shameika, would you please give us your thoughts about what's going on, how it relates to how you carry on about your daily life?
So, I'm really thankful that you all have this platform, because I think it really starts with a lot of education and a lot of awareness. And I think because of so much of what's going on right now, even though for a lot of us, we have a lot of different feelings and a lot of emotions about what's going on, the one thing that makes me feel somewhat happy or somewhat satisfied is because now people can't escape and get away from it. Some of us in the work that we do, it's a part of what we do, like social work is all about social justice. So that is a part of the work that we do. But then I know in so many other areas, people, it may not be as obvious and some people may not know, but right now again, the world is watching, the world is participating. So I think it's a perfect opportunity for people to, if nothing else, to observe and to be aware and to take their seats or whatever their place is in this movement. But I think, as you were saying, it's really important because a lot of this stuff is intertwined, and it really, in a lot of ways, snapshot the experience of being Black in America. Whether you're going to the doctor, whether you are in the classroom and education setting, whether you are walking down the street, whatever it is, what is the experience of being Black? And that may vary in some areas, but we know sometimes it can have some very adverse outcomes. One of the things that I look at is some of this stuff is just a part of what the narrative have been because it's embedded in the fabric of how the country was founded, of course, right? So when we talk about systematic oppression, when we talk about racial oppression, when we talk about all those different things, it sort of have created the recipe for what we see now. A lot of the systems that allow for what we see now, at one point, some of these things were actually legal. And so even though the laws may not be there that allow that, the mindset is still there. So we're now still dealing with the residue of all these different things. And again, I'm happy in the sense that we can have these conversations so we can really talk about these things, so we can be aware, have tools, but also push for reform to change the policies and whatever that need to take place so that we can have the justice that our community needs.
Yeah, no, absolutely. And Ms. Kenan?
Yeah, to echo what both Dr. Stokes and Dr. Alvarez stated, I think now is just right. So we all have our feelings, and at some point we were kind of, could say we were removed from it because our generation, our parents and our grandparents kind of went through it, and then it was kind of suppressed, and we didn't really maybe feel the effects as much as those generations did. But now with, social media, with electronics, with technology, right, we're forced to look at this and say, oh no, this is still a huge problem in our society. And so we have to carry on the work that, our parents did, our grandparents, and, all the Malcolm X's and Reverend Al Sharptons and Martin Luther King. So now we have to carry on that because we still have a lot of work to do. I did just see, that today that being Black is now is a health concern. So now I just read an article that that because we have such bad outcomes or worse outcomes than other ethnicities, that has now become a public health emergency. So with what we're seeing now, right, is so much bigger than, unfortunately, those individuals had to lose their lives, but it does open up the ability, or just opens up for us to say, we gotta make a change. We gotta do things differently. We gotta look at policies. We gotta look at the way we think. We gotta we gotta make a change.
Right. And for me, like from a healthcare perspective, the healthcare system was never really made for us in general, and it was built on racism. So I hear a lot of people talking about, well, implicit bias training. Everybody needs to have implicit bias training. And for me, I'm just kind of like, okay, so you get these doctors to go to this training class, and then they come out of this training class, and then what? Right? So how do you feel about like that? What do you think, like from a healthcare perspective, needs to actually happen? Because for me, I feel like it should be accountability. So if you take this class, or if something happens, you need to be held accountable for whatever happened, instead of getting, pushed under the rug or not talked about at all. So how do you feel like, because I feel like implicit bias training, for some it may, bring some stuff to light, but I feel like for the most part, it's not going to do much.
Right.
You know how everybody's like real hyped when you go to your training class, you get real hyped about what you learned, but then 3 days later, you don't even remember. So I'm just kind of curious what you think about that.
I think it is important, again, to educate and to look at your own biases and to call your own self out to see, what things are holding me back from providing the best care to my patients. Looking at patient outcomes, because research has shown, we know that African Americans, or have worse outcomes. So, what are my patient outcomes? Am my patient's blood pressure being lowered, or are their diabetes under control? Are they being aware of the dangers that they're much at a higher risk for COVID-19? So looking at provider outcomes. But again, that goes back to structural and institutional policies that are in place that affect the people of color, worse outcomes. So I think, it is being culturally sensitive, knowing the culture of the patients that you're working with is very important, because what works for me is not going to work for a Caucasian or for a Latino. So it is important to know, to be culturally sensitive to the population that you're working with. And then going to those classes, because some people don't even know. Some providers don't even know that they hold this bias. So it is good to go to these things, go to these classes, learn about it, and give them tools, like Dr. Stokes was saying, give them tools to make a change, to make a difference. And then looking at outcomes, you gotta look at your outcomes. What are your patients? Are they, like I said, are they under control? The diabetes under control? Is their blood pressure? So you have to follow up and see how those providers' outcomes.
Okay.
Yeah, like I was talking to my best friend Lauren, and it was like we were talking about like they just recently passed like a law or some kind of bill saying that it was illegal to discriminate against African American women based on their hair, how their hair naturally grows out of their head. Like you have to pass a law to tell people that. It just blows my mind. Like you have to tell people you can't be mad at somebody the way their hair naturally grows.
My question to you is, why are you surprised?
I'm not. But it's like when you have the conversation with people, like, oh, why are you so mad? Like, why? How come you're mad about everything that's going on? Like, because of stupid stuff like that. Like it's just aggravating to say the least.
The fact that you have to pass a law for somebody to be.
Yeah, the fact that we have to tell you that the KKK is bad in California, like a white basketball player was like the guy from the Lakers. He's like, why does a petition need to be signed by 500,000 people to tell you that this is bad? Like it's obvious. Why? Like what are you doing? Anyway, okay, I kind of got off topic because it made me go mad. It's just so dumb.
Can I say one thing?
Yeah, absolutely.
Okay, so I was as you was talking, I was thinking that because I think that a lot of the training and education is important, because a lot of times most of us, we don't think about what our level of privilege is, right? So we all have a privilege, and a lot of times we're not necessarily aware of it because it's just who we are, and we don't think about it a lot of times. Until we're confronted with it, or there's a conversation, like, for example, Brandon, with you being a male, just the privilege of being a male versus being female because of, sexism and different things, or the privilege of being heterosexual versus being at a disadvantage and being a part of the LGBTQ community. So I think a lot of times people may not necessarily think about their privilege, or sometimes when creating policies or laws of things, people may see it from their perspective, and sometimes their perspective may not be something that's sensitive to others. And so I think that as we move to being more inclusive and having more opportunities to be able to engage and talk, we learn from each other, and then we begin to reform and change laws and create those cultures and environment where everyone feels safe and where everybody feels accepted.
Good. So that kind of like one of my next thoughts or questions was going to be to everybody is, so if you had to sit down with some policy changers or lawmakers, what type of questions would you ask them, and like what type of I guess controls would you ask to be put in place to start making systemic or infrastructural changes? So like Dr. Ana, we'll start with you. Like if you had to sit down with, I guess, essentially some like white families or white like people, or just people that aren't Black, that may not necessarily go through the same struggle as we go through, that are in positions of power to make these changes, what would you like? How would you have that conversation with them? What would you ask them to do or change?
So one of the things that I'm learning about, and I'm becoming and doing more research on, are the social determinants of health. At my current career, my current position, I am a community relations manager, and I'm really having the opportunity to study different states, study their culture, study their programming, and really understand the gaps in services and how the social determinants of health really plays a role in the health disparities. So I think one of the questions that I will have with policy makers, policy changers, and those who are in positions to really make change is to ask them, do they understand how these social determinants of health are really embedded and really focused on how the foundation of the US, of our society, was created, right? That is primarily made to benefit a particular race in society. And in order to create change and to really make change, we really need to study the gaps in education for people of color, for Blacks, the lack of access to quality health care, the lack of access to um, affordable housing or housing, the lack of employment opportunities. Do we really understand how all of this is really was created in the basis of racism and of exclusion? I think we need to have those hard conversations to understand that in order to make change in the social determinants of health, we really need to understand the foundation and the basis of how it was created to really dismantle that and create change.
Good.
Very true. And from what you're saying, like right now, I'm all about healthcare. So when it relates to healthcare, especially obstetrics. So obstetrics was founded, or the father of obstetrics, Dr. Sims, I think is his name. He used slaves pretty much as guinea pigs. And it's documented that Black people, women specifically, don't feel pain. And this was taught to people becoming doctors because he didn't provide anesthesia for his slaves that he also used as nurses. So just like the history, it was built on racism. So from like a healthcare point, this is why this is still this way, because up until a few years ago, people literally still thought that Black people's skin was thicker than white people's skin.
And these are people that are cutting people open so they see the measurements of skin on different colors, which is the same for all races of people. So how could you be a medical professional and think that when you're doing it, that is called cognitive dissonance. That's what that's called. So it's just very frustrating.
He's frustrated.
But I have to add, in terms of the social determinants of health and my current role, I think my current employer and maybe other health insurance companies are doing this, but in my role, really understanding what resources are available to our members in these different states, understanding what are the needs of the population, and really being innovative in how we address those issues and concerns and needs is critical, right? And it's a start. And I think it's a good way to start the process of change. And one of the things that my employer does is that we have conversations with our providers and we let them know this is what we're seeing in the state. These are the gaps in services. And we have case managers or community connectors that really focus on understanding what are your needs. Do you need housing? Do you need food? Do you need transportation to go to your health appointment, so that they are not alone? What we call it is creating a wraparound service around the member so that their health care and their quality of care in relation to their health care is a priority. But in order for it to be a priority, we have to tackle all the other needs that they have in terms of education, transportation, food. If people don't have the basic needs, they're not going to make a medical appointment.
Right.
So I think it's great for health insurance companies to really tackle those needs in order to make a change in their healthcare.
Right. So essentially shoring up the infrastructure of the community so we can at least get to the level to start getting the benefit out of those resources. Because we're so, essentially as a whole, we're too low to even be at the right level. So we got to basically shore up the foundation to get them where we need to. So that's good. That's good. So Tasha, if you had to sit down with some policy changers and make it, what questions or direction would you give them?
So definitely being diverse, right? You want to have people at the table that are diverse and not the same type of people, because then you may fall into groupthink where everybody's thinking the same thing. So definitely you want to have a diverse group of people that's around you. As Dr. Stokes said, that you can have different experiences, you have different expertise at the table, and so that you can start those conversations. And definitely, like Dr. Alvarez says, social determinants of health is huge because, right, if you living in a food desert, which, there's not grocery stores or you don't have fresh fruits and vegetables, then you're going to eat things that, that have a prolonged shelf life, which may contribute to, your high blood pressure. So definitely having a team of people with which, you can't, it's, healthcare providers already have a lot that they should be following. There are guidelines they should be following and things that should be looking at. But having a team of people that can look at those things, look at those resources, connect people to where they need to be, whether it's housing or whether it's transportation, and even going back, to those that are coming out of incarceration, like getting them healthcare and getting them to providers and making appointments and making that a priority for them, giving them resources. So looking at, just having diverse people at the table, and then really being open to having a conversation to say these are the issues that we're facing as African Americans or people of color.
Right. And Dr. Shameika, if you could have this conversation with policy changers, what would you say to them?
I think if I had the eye and the ear of policymakers, and I feel the two are connected, but it would be around criminal justice reform, specifically how we incarcerate, looking at restoring the humanity in people while they're incarcerated. Because as we know, when we look at victims, a lot of the individuals, when we look at people that are incarcerated, they have some of the highest what we call ACEs when we look at sort of adverse childhood experiences. So a lot of pretty much negative or bad things that have happened in life that have impacted them. And I believe that that's one reason why many people are incarcerated, because of some of the experiences they've had. And so one of the things that I really push for is really looking at treating and helping people holistically. So looking at all the areas of their life and not just recommending it, but mandating that form of treating, especially with prisoners, because they are technically a part of the state or the federal system. So looking at what type of services that we can mandate while they're there, and really looking at services that are going to restore their dignity, their humanity. Because again, when we look at how people are incarcerated, you give them a number, right? You take a lot of different things away from them. So I'm thinking from a mental health standpoint. So when you take things from people, what do you leave them with, right? And then for some people is they, depending on their experiences, they maybe didn't have a lot of different things, or so my biggest thing is, again, looking at how we can restore to help people. Hurt people. So if we're really looking at changing things, we really have to look at and I say the incarceration population because that is a huge population. And not just that, when people are incarcerated, that affects every aspect of society. It affects their family, it affects our communities. And again, I want to go back to the part about African American men, because a large percentage of African American men are within the prison or the criminal justice system, whether that be probation, parole, whatever those systems are. And so I really think we have to look at restoring and providing some different level of services to move people beyond survival and moving into thriving. Because I believe once we do that, then we'll begin to see that overflow economically, socially. And so I think that is something that we really need to have conversations about, like yesterday.
Yeah.
Yeah.
Yeah. So like, I guess like part of the whole reform thing. So I think like the one thing that came out of the Affordable Care Act, or as a lot of people call it, Obamacare, which is dumb. Anyway, something beneficial that came about from that is it gave a lot of people access to affordable health care. So there are a lot of unintended benefits of having access to healthcare, because like a lot of people are working like temp jobs or like day labor jobs and stuff like that. So they don't have access to even have healthcare because they're getting paid in cash. But with the Affordable Care Act making healthcare so accessible, it allowed people to get drug screenings, allowed people to get preventative maintenance, pre-screening for cancers, pre-screening for whatever they had going on. So it, in a nutshell, or not to make it too complex, in not so many words, it helped extend the lives of people because they were able to do stuff. They were able to get their teeth fixed and, just do the basic stuff to lead a healthy life that they didn't otherwise have access to. But this administration is trying to pull it back. So it's going to affect white people as much as it affects black people, because we don't make up 100% of the population, which, contrary to popular opinion, kind of blow some people away. They might not know that black people are outnumbered in the United States or whatever. So we're here to provide information and educate people. So white people are going to suffer. The poor white population is going to suffer just as much as the black population, but that's not the focus. I guess like it would take something like that on a national level to kind of help, give black people some more benefits in that community. I don't know how we would do that, but
we're actually the only country that doesn't think people need care, like across the board.
Yeah, there's like
I think we're the only ones left that don't actually think like everyone in our country deserves like health care.
Yeah,
a healthcare system to where it works for everybody.
Yeah,
that's crazy to me.
Shameika, I like what you said about the criminal justice reform. So put the humanity in reform. So by putting the humanity in reform is humanizing the criminal. Because I think a lot of people, like, they see criminal, they're just, some of that stigma is like, I don't want to hire him because, he had a bad past and he's an animal and he's going to attack everybody, when he comes to work and this and that. And I think, like, and also what Dr. Anders said, like, basically labels are unjustly or unfairly thrust upon us. So it's like we work 3 times as hard to get the label off of us. People assume that black people are lazy or they're ignorant or dumb or whatever. But it's like, we like, did you talk to us? Did you ask us any questions? Like, they would assume that you don't know what you're talking about, but like, I just got a doctorate in social work. Like, explain to me about prison reform, please, since you know so much. So it's basically like, what I'm saying? If you treat people as humans, or like I was talking to some people at work, like, it's like God is love. And if you approach conversations with love, you look at it different. So you're open to having more civilized conversations with people. So, but if you approach it with hate, then it's like you're already closed-minded, because like you're approaching it like with the mindset of, I'm waiting for them to stop talking so I can say my piece. So at a micro level, there is some hate in that because you don't want to hear what they have to say. But if you open with love, then you know what I'm saying, you're more open to it.
And can I piggyback off of something you were saying, Brandon?
Go ahead.
And I think you touched on some important elements, because you mentioned something about, and I think I can't remember if it was church or whatever, but I think that is really important. And Tamika and I have talked about this, about engaging the faith-based community, the churches and stuff, because whenever we talk about and really dissect the problems, is layers and layers to this thing, and it's really going to take so many of us as organizations or within our capacity to work together, right, on the individual level. Like Mika was sharing a minute ago when she was talking about the doctor and accountability. So having the laws and the policies, but also to, again, having the faith-based communities, people working in the community. And I think it just shows on all levels that it's a lot of work that we have to do. I look at just what's taking place in the country and how, people may agree or disagree with the demonstrations that's taking place. Mm-hmm. But I believe that to be that we all have a voice, right? And a lot of times people are doing what they are expressing themselves, right, wrong, or indifferent. And I think that for some of us, we need to look at what level of privilege or what tools we do have and how we can help in whatever capacity that we're in to bring about change, right? For the educators, for them to educate, for the policy people, if that's your area, pushing things on that level, for people that are grassroots, that are in the community, what is your platform right now with social media, just going live and having these open conversations so that, we're able to have these dialogues so that people are aware, so we're able to learn from each other. And I think it's all a part of what we need in order to have that forward movement that I think we all want.
Right. And when you say like faith-based communities, I think it's also important to like everybody to know it's not just Christians that have a faith. Is Muslims, Orthodox Jews, Methodist, Protestant, whatever God you believe in. There should be a moral compass that comes along with being in a faith-based community. So if you love God, if God is love, then you know what I'm saying? Why are you hating somebody that you never met, you don't know anything about on the color of their skin? Like whether you're gay, straight, bi, whatever. It doesn't matter. Like give them a chance to be a human first, and then if you're an asshole, then you're an asshole. It doesn't matter if you're straight or gay. You're just an asshole. So you know what I'm saying? So it's like they just assume that the asshole comes before being a human. So like give them a chance, man.
So if most people treated humans the way they treat their dogs, then the world will be a better place.
Yep. And yeah, so like Michael Vick, like I know some people get mad about it, but Michael Vick served more time than I don't know the statistic, but I'm pretty sure he served more time than a lot of cops that have killed black people on camera. Like there's video evidence of it. And he still more time. It just blows my.
But I was just gonna say, I think that whenever we look at though how some people may not share the same values, I think it goes again when we look at the history of our country, because again when we look at people of color, particularly African Americans, it wasn't legal to treat African Americans the same way you would a white person, right? So the reality is, even when we look at laws and we think about the treatment of children, there were laws in place to protect animals before there were laws in place to protect children. So that's why I think a lot of it needs to do with education and restoration, because we haven't always been on a level playing field, whether we look at children, whether we look at people of color, or even if we want to be totally inclusive, to look at the LGBT community right now, right? Because we all have biases, prejudices, assumptions. Sometimes they're against races of people. So I think that we really have to have a lot of conversations and really start to challenge each other, what we see, even challenge sometimes what we've learned. Because for some of us, we're unlearning things, unhealthy things. But we haven't all started off the same. So as Black people, I've been taught to love myself. So, I didn't have to learn that. Right. But somebody else that maybe had a different experiences, and those experiences that they have, they bring those experiences wherever they go. And so that's when I think we begin to see a lot of that in a lot of different sectors of society, because what have we been taught? And again, when we go back historically and we look at the systems, particularly when we look at Black Americans have not been treated. We were not treated as full human beings. So that mindset still may be there. And again, I just made that reference with children too, because even when we look at children in society, you're to be seen and not heard. So I think it's a time for us too to begin to challenge what we believe, right? Because it may or may not be right, or is it right for who? Whose right are we talking about?
Right. And also to piggyback off of that is like, we need to learn. So reading is fundamental. Like that's an old saying. It's like there's so much information available, but a lot of people are just too lazy to read and go search out the information. It's like they're willfully ignorant and they just don't want to believe it. So cognitive dissonance against, like, you know what's right, but you going against what you know is right.
I know. It's not like Dr. Stokes said, not like not being afraid to have those conversations, because
right, ask the question. Like, if you don't understand something and you know somebody that may be able to answer the question for you, ask the question.
Absolutely.
They can answer it or not, or lead you in the right direction. You just have to ask the question.
Yeah, and mandating change or mandating change by way of laws or policies is making it mandatory. Like, it's making the laws of treating people better mandatory instead of making it optional. You know, like a lot of stuff they're trying to, like, oh, if you feel like treating them okay, then maybe we'll hold you accountable. Maybe we'll do something. But if you don't, then don't worry about it. But if you make it a law, like, they made it a law to give every American $1,200. Like, a lot of people don't know that. Like, that is a law. That was the law. So once he signed it, it was the law. He would have been breaking the law not to give you the $1,200. Like, a lot of people don't understand that. But
I think as we talk about laws and policies too, you have to look at the individual, the people too, because this is generational, right? This is years and years and years. So you have these policies and laws in place, but how do they affect the people that they're for? Is someone that is from whatever, I mean, are they going to be able to receive it? How can we get them to say, this is a good thing. This is for you. This is going to help you change your, generational disadvantage. And so sometimes you got to figure out how can we get people to understand that and move into their space where they're able to receive those policies or those change or those laws, or just able to receive those, just have a conversation. And ask, and like Shameika said, just ask about, what is it that you need? Maybe I need transportation to get to a job so that I don't choose another type of way to make money. Maybe I need whatever you need. Maybe I've experienced a trauma. I need to get some kind of psychological or mental health. I can move past it so that I don't have that same cycle of whatever the outcome is. So just figuring out what is it that the person need, and then trying to get them that service, like the gap they were saying. What is it that the people need, and then getting them to that service so that it can move past it and move, make a different choice.
Gotcha.
You touched on something that I want to. When we talk about policy too, we also have to realize that some of the policies and the laws that they made were actually to hinder progress in some areas. So, we have to be careful when people are, like you said, making laws. Some of the laws they built were actually racist laws. You know what I mean? Like, to keep Black people where they are or in certain communities. And it's a lot. Like, it's a lot across the board to try to combat. But, we have to be careful about people making laws too, because some of the laws were made to keep Black people on welfare.
Right. Yeah. And I don't know the complexity of lawmaking or policy making and all that stuff.
And you have to have the right people in place to pass these laws too.
Right.
So, from a lobbying perspective, Shameika lobbies a lot, Dr. Stokes lobbies, and I've been on Capitol Hill myself, and I've had the experience of talking to somebody I knew in my bones did not care what I was saying. So when it's very important to have the people in place to change the laws. So that's why it's important for us to vote, so we can get the right people in place to actually, not always, but care about the issues that we're presenting to them, or the policies that we're presenting to them.
Like, people need to vote on a local level, it's not just for the president.
Your congressmen and all your senators and all that stuff. Y'all, anytime there's some time for y'all to vote, y'all need to vote.
Right. And so this is all very good, and we're almost out of time. So it kind of brings me, all of that is very good, and brings us to the last point. So with everything that's going on, the protesting and I don't want to say rioting because I think it's more peaceful protesting than rioting. It's just pockets of it that the media is deciding to focus on. But with the peaceful protesting so far, there's been a lot of good changes. I had a list, but I forgot what changes have been made. But they have started to make incremental changes, which is good. We kind of need it more on a broad scale, part of the restoral part. So, Dr. Ana, we'll start with you. What would you say we should do next, or like what does the future look like for us after if these changes were to kind of start snowballing? What would you like to see? Can you hear me?
I can start. I think for me, it would be I want to continue these conversations. I want to allow myself and for others that if you're put in a position where you have a voice, and I think we all have a voice, to utilize that voice, to speak up, to promote the change we want to see, to call out microaggressions, to call out racism, and to have those hard conversations whenever possible, because I think that's what creates the change. And that's what creates, you can touch someone that doesn't understand and that is willing to listen. I think listening, being open, being educated, but ultimately, the force and what we need to continue to do, and what I hope to continue to do, is to feel empowered to always speak up, to not fall for being in corporate America and being okay with microaggressions, but being able to call it out and not allow to be disrespected, not allow for my people to be disrespected, and really have a voice for change and really speak up to what I want to see. And one of the things that I want to touch on also is that for me, it's been very important to take care of my mental health as I'm advocating for all of this. When everything happened with George Floyd, a lot of things resurfaced for me that I had suppressed. And it was very challenging to have those conversations because I had to process everything that I've dealt with for so many years. The microaggression, the racism, not being accepted, having to go into a space and not being recognized and acknowledged. So I think it's important for me to take care of my mental health in order to continue this fight, because it's going to be hard, it's going to be challenging. There are a lot of people who are still not open and accepting that change needs to happen. And in order to create that impact that I want to see, create that change, I need to be well mentally, emotionally, in order to continue this fight.
Absolutely.
Okay, Tasha. So, and you being a nurse and being in there, I know you kind of touched on long term changes. So, what would what would be next for you? What would you like to see in the next 6 months to a year to 5 years and whatnot?
Definitely. Like I said, the article I was reading this morning, that racism is a public health issue, in that that is acknowledged in the healthcare field. Definitely, we talked about a little bit about implicit bias training and cultural sensitivity. And so definitely having that in educational programs, in medical programs, nursing programs, whatever healthcare field you're going into, but having that type of education embedded into those programs, and just knowing that patients are different. There's guidelines, there's research on how we should treat our patients, but you got to look at the individual patient and look at it from an individual standpoint and say, how can I best treat this patient? And make sure that you're checking your own biases and your own privilege and your own experiences at the door, because this person is different. Is different. And I'll speak for myself. The person is different from me. So I have to make sure that I am treating them, like I said, as an individual, and checking my own awareness and biases against that person, because I ultimately want to make sure that I'm taking care of them, and that's what I went to school for. That's the oath that healthcare providers take, that you're here to take care of the patient. And if you having issues with it, then have a conversation, speak up, and say, I'm struggling with this. How can I move past this? Because I want to be the best healthcare provider that I can be. And again, having different people at the table making decisions, and helping to make policies and laws that are for the greater good.
Right.
Just being the best healthcare provider, and taking care of your patient not based off the color of their skin, or social, socioeconomic status, or their educational
level in healthcare.
Yep.
Right. Yeah.
Because they're human, bringing that.
Because they're human, because they're a human being.
Right.
And that's what we we went to school for, and that's the oath that we take care of the person, right? Because they're human, and not, like I said, because the color of their skin, how much money they make, their educational level, the language they speak, their criminal background.
Right.
None of that should matter.
Right. All right. And Dr. Stokes, what does the near future and the far future look like for you?
I agree with what everyone else said. I think that I would like to see us, for just as a community, all people to, and particularly African Americans, tapping more into the mental health system, especially now as we begin down the process. And for many of us, feel free and comfortable sharing our experiences, so we don't have to normalize those experiences anymore, but acknowledging that we're probably not okay in some areas, and understanding and being open to some other things. I know that with the healthcare system, there's been a lot of distrust with people of color, but I'm hoping we can, challenge some of those norms, so we can begin to heal in a lot of areas of our life, right? Mm-hmm. Economically, mentally, because I feel like if we are better as human beings, we're going to be better in every aspect of our life. So for people that are on the front lines, as well as people behind the scenes that's taking everything in. So I hope that during this time and beyond this time, that we can again begin to examine our mental health, to seek help, and seeking professional help, to be able to again normalize and take advantage of some of the services that are out there, some of the services that's going to give us an advantage, so that we are well individually and well as a community. So definitely, again, advocating for mental health within the African American community, so that we can get services that a lot of us need.
Amen. Amen.
Okay, so just to kind of give like a recap, overview of that question, what everybody said. So basically, keep scheduling meetings, or keep the conversations going by probably having meetings, not necessarily every week or month or whatever, maybe like every 3 months or 6 months, or at least 2 times a year, so people can, voice their concerns, or at least to keep the conversation at the forefront. So it's not. No, I'm saying like keeping the conversation going, like corporately, in the hospital, in your own home, if you're talking to your children. Because one thing, like the kid, like children are watching. Like the young generation is watching. Like the kids that can't be out in the streets and stuff, they are watching, seeing what we're doing, and it's the onus is on us to show them the right direction. And now is the time to start making those changes, because you teach your child up in the way that they should go while they're young, and when they get old, they won't depart from it. So as they're young, it will teach them now. As they get older, then they'll start to see like what they're seeing now is, I want to say, it's a little bit from our generation raising those kids, saying like you shouldn't be treating people like that. Although it's not as widespread as it needs to be, there have been parents like bring them up now saying that those things weren't right. So that's why they're out there protesting in the streets with us and raising hell, because to see a man die like that and call out for his mother is like, a lot of people felt that, and a lot of mothers felt that. So like, if my baby died like that, I'm burning everything down. Like the whole world all y'all gotta go. Everybody gotta die. And like Dave Chappelle said, when the cops, when one of their own is killed, they rally behind each other and destroy everything in their path trying to get to that person.
Everybody's trying to get that one person.
Yeah. So why are they surprised when the entire world is getting behind somebody that's calling out as they're dying in anguish? Anyway, so keep the conversations going. Don't punish people for speaking their minds. Like, allow people to have a voice and don't get mad at them for being like, "Hey, you treated me like trash." Like, "Oh, just shut up and dribble." Like, no, you treat me like trash. Like, I don't want to be busted upside the head just because I'm walking down the street, you idiot. Take care of your mental health. So I think a lot of people, so making it, allowing those conversations to be had, I think that also kind of contributes to your mental health, because for so long there's a stigma against Black people going to receive mental health or just talking about any of their problems. And the very fact that that woman said, "Shut up and dribble," it that statement alone is so deep, because it's like, you're not allowed to talk, you're not allowed to have a voice, you're not allowed to speak about your problems, you're not allowed to address your concerns. So that statement in and of itself is so racist. That was a racist microaggression.
She said it to the right one too, because LeBron ain't about that.
Yeah, so that we could do a podcast on just that. So take care of your mental health.
And I also want to add, Brandon, too, that as they both said, it's not easy work. It's not a short. It's not going to happen in a short amount of time. So we got to, stay the course, and stay strong. Take care of your mental health. But this is layers to this. So you got this as many years of things that you have to unpack. So
right. And also, and another thing was, so we need to get more education, more continuing education, and kind of more accountability in the healthcare system, in the prison system, the lawmaking system, allowing for acknowledgement of lack of quality of care without fear of being punished or yelled at or whatever the case is, and allowing people to take advantage of services that could be or should be provided to them. So it's a lot, but I know which is why we set out on this journey, and we thank you. We thank you all for sitting down with us, having this conversation. Hopefully, we're gonna continue to use our platform to continue the conversations and try to interview more people and get different perspectives on what's going on and how we can make these changes. And Shameika's on a lot of panels and board discussions and lobbying, and Tamika's lobbying, and Tasha's in the hospital, and Dr. Shameika. Sorry. Yeah, you aren't you on a couple of different boards? Oh, I'm sorry. I'm getting policed over here. Dr. Ana and her role with her current organization. So we thank you so much for joining us in this panel discussion. We thank you for helping us shed light on everything that's going on, or specifically as it relates to us, and helping Jace's journey kind of spread information, education, and awareness, and helping us to continue push our goal and mission.
I also want to say to everybody who's watching in the panel, we need to have more empathy, especially with the current climate. People are, like y'all said, processing a lot of stuff that has been suppressed. So I think as a country, as human beings, that we need to have empathy for each other, because we don't know how everything that's happening is affecting everybody else.
Yeah.
So in your day-to-day lives, and at work, and if people are going to work or what you're doing, just have some empathy. Have empathy for whoever it is.
Because everybody's on edge. Like, white people don't know if Black people are mad at them just because they're white. Black people don't know if white people are mad because the community or neighborhood might be
Black lives matter too.
Yeah, it's getting destroyed. It's like, so it's just, it's like, hey, how you doing? Like, you just ask the question, just have the conversation. Like, there's no, what I'm saying? Like, hopefully nobody's gonna stab you while you're at work. Like, just say hi, and it's like, hey, I know there's a lot going on. If you want to talk, I'll listen. If not, I'm gonna keep it moving. Then that goes, for all sides. Like everybody might not want to talk about it because they might get upset. So give people space and opportunity to kind of, what I'm saying, let it come out or not come out. Maybe you might not want to have this type of conversation at work because you ain't gonna get no work done. So you're gonna be something. But just make yourself available and just calm down a little bit. And okay, I'm sorry. Another thing, because I saw this thing, a pastor had wrote it, talking about when people say Black Lives Matter. Of course, all lives matter. Like we're not saying that all lives don't matter. It's just right now we're having a problem with people noticing the Black lives.
I'm really over with having to explain that.
Yeah,
so.
But it's like, but that right there is a form of microaggression because if you say all lives matter or blue lives matter or whatever lives matter other than Black Lives Matter right now, it like you're trying to discredit again Black people. Not that we hate. I don't hate white people. I don't really hate anybody. If I hate you, it's because you deserve to be hated. I'm just gonna put that out there. But with the conversation is Black Lives Matter because they're being unjustly or unfairly.
Yeah, I think there was a good example of how to relate to that, and it was like in October when we celebrate breast cancer awareness month. You don't hear people in the background saying, "Well, what about colon cancer?"
Yeah,
I mean, cancer affects everybody in different ways, but saying Black Lives Matter does not mean that nobody else's lives matter. It's just that we're the ones that are dying at this point.
Yeah,
and more focus needs to be on that versus other lives that aren't in danger.
Right. So to give you a visual of like what we're talking about. So just imagine your neighborhood. There's 5 houses in that neighborhood. The middle house is on fire. That is the Black Lives Matter house. That house is on fire. So the fire department comes to put out that fire on that house. Oh, why are you spraying water on that house? All houses matter. Why don't you spray all the houses? Like, yeah, but that's the house on fire. We're trying to put that fire out right now. So let us focus on that fire so the whole entire neighborhood doesn't burn down, which is what's going on right now. They are burning down the entire neighborhood, which is the United States of America. So let us put out the Black Lives Matter fire and nobody's house will be on fire. You know what I'm saying?
Right.
Okay. I'm kind of like it's been a lot of frustration, but I'm good though. I love people. I love people. I'm cool. So that's my spiel. I love you guys. Thank you so much for joining us. Thank you so much, everybody, for watching along with us, showing us mad love, mad support. Jace's Journey 5K is live. Registration is live. If you notice my shirt, this is the one from last year. We got the one for this year is October 24th, the last Saturday in October. We added a costume fun run element. We're giving out a prize for best costume. The first 25 registrants are getting a Jason's Journey mask. We'll put a picture of it on the website and our Facebook page so you can see what you get. So if you guys know any corporate sponsors or you want to sponsor, please send us an email. We will get you the sponsorship packages and hopefully this year, I think this year it'll be 10 times better than it was last year. We have put the link up in the Sinead Miller. Hey, Nay. She put up the link for the 5K fun run this year. Please go on there. Sign up, run. We'll be there. We'll be taking pictures, loving on people, hugging people. Well, if COVID-19 is still going on, we might not hug you, but we'll love on you from afar. We'll kind of give you an air high five or down or something like that. But we'll love on you some kind of way. But we do thank you. We appreciate it. And we will talk to you all next week. All right. Okay. Love you. Bye.
Thanks, guys.
Thank you.
Bye. Thank you.
Bye. Thank you.
Bye.